Hi, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and take actions to try and make a better system for all of us. Today we're going to talk about lung cancer, we're going to talk about single payer at the state level, and there's an immediate action that's really important to take today. But before we get to it, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter. And that newsletter is the text for today's video. All of the backup material and references and news stories and analyses that I talk about and actions, all of that stuff is in the newsletter. And of course, you can subscribe for free to Healthcare Advocacy newsletter and have stuff delivered to your inbox every day. Okay, I want to talk about early warning signs for lung cancer. In the newsletter, and I guess in the YouTube description box, I'll put a link to an important story on lung cancer. There are a number of early symptoms of which it is really important to be aware, and some of them are very subtle. Some of them have to do with fingernails, and some of them have to do with pain in the neck and maybe in the head. And there are about 12 or 15 different things. And it's important to take a look because early detection really means you get to live. You get treatment, you get to live. It is just so important. Anyway, and there is new guidance that people between 50 and 80, like me, that used to smoke for more than 20 years, like me, should get a screening. Early detection means you get to live. So go to the link, take a look, get in touch with your doctor. Let's talk about single payer insurance at the state level. Other countries began their journey to universal single payer, like HR 3421, by having individual locations or states try it first. To make that work in the US, the individual states need waivers from certain federal agencies. It can be complicated to get each waiver done separately. So there's actually legislation in Congress that's going to be introduced in the Senate, I think this week on Friday, to help smooth that path. Senator Ed Markey from Massachusetts has agreed to introduce the Senate companion bill to Representative Ro Khanna from California, his bill HR 6250, which is called State-Based Universal Healthcare Act. As soon as, I guess next week, they're thinking about introducing it. Look, it's really important to get senators on board with this. There's a cutoff, hopefully, of this Friday, March 29th, 5 p.m. Eastern Time, for original co-sponsoring by senators. So here's a quick action. This is just super easy to do. Call the Capitol Hill switchboard. Let me give you that number, 202-224-3121. Call them first thing in the morning. Call them every morning. And urge your senators, both of them, to co-sponsor SBUHCA, the State-Based Universal Healthcare Act. You can also use emails for them or portal messages if you want. You can put it on social media, anything that gets them going. And I'll tell you, I'll put links into I'll put the phone number into the YouTube box. And if you want to do it by email, there's a democracy.io website that also tells you how to get in touch with them by email. Here, I did it, and here's what I said. I'm your constituent, and my name is, put in your name, and I live in this zip code, give your zip code, and I want you to give states a fair shot at universal single-payer health care. Co-sponsor Senator Markey's State-Based Universal Health Care Act, the companion bill to Ro Khanna's HR 6250. It makes a clear path of waivers to allow states to cover all their residents. Thank you. That's all you have to do. Take you 30 seconds. Okay, the FDA needs you, or maybe somebody you know. I received an email from the General Accounting Office. They had completed a report that identifies the need for more FDA inspectors. And of course, in the Healthcare Advocacy newsletter, there's a link to the report. I decided to go take a look once I saw that, and I went to the government website for jobs, and sure enough, there's the link of FDA jobs. There were about 125 of them available. And I got to tell you, some of them look like a lot of fun doing important work. They each have a set of requirements when you go to each job, including education requirements. I checked out the scientist one, and what they wanted was a bachelor's degree in some medical or health or some related science field. I think they also have a lot of intern positions. Now, when I worked in the aerospace industry, let me tell you how that would work. We would hire interns and then teach them the ropes of the job, then let them go back and finish school. And then when they finish school, you offer them a job and you bring them in full time. So look, pass it on. You might know somebody who would like a job with the FDA. Let's talk about fair drug prices. We've mentioned in the past the government's negotiation on Medicare for 10 drugs, and we've mentioned that Florida is now pursuing a course to purchase prescription drugs from Canada, making use of their national health care by buying the drugs which are cheaper there and importing them to the U.S. The U.S. is running up against lawsuit after lawsuit trying to negotiate Medicare's price for 10 drugs. The state of Colorado, however, has taken another path. They just passed a law establishing a board to review the fair price of any prescription medication sold in Colorado. The state has already said 604 drugs met the first criteria to undergo an affordability review. Woohoo! The full list of drugs is linked from the board's webpage in the newsletter, along with a list, in order, of those it has slated for priority review. The Colorado board will spend the summer setting up payment levels for drugs selected for price reviews. Drug makers can then appeal. The board plans to examine how manufacturers price and raise prices for drugs. For generics, the board's director, Lila Cummings, said at a February 23rd meeting, the criteria could include whether the price paid by wholesalers before discounts has increased at least 200% in the past year, and whether a 30-day supply costs more than $100. That's a fortune. Keep in mind, each pill usually costs about a penny to make. Branded drugs that cost more than $30,000 a year, or whose wholesale price has increased at least 10% in the past year, could land in the board's sights, as could biosimilars that aren't at least 15% cheaper than the brand name biologics they're intended to replace, Cummings said. The 5-member board, appointed by Governor Jared Polis, includes 2 medical doctors, 2 pharmacists, and a hospital executive. A 15-member advisory council includes patient advocates, that's good to do that, insurers, pharmacists, and representatives of drug manufacturers. So they're going to get all points of view on this. The Colorado law creating the board set out a lengthy process for any drug maker that decides to withdraw their product from the state over the price caps. Note that the state is also exploring importing cheaper drugs from Canada. They haven't had too much success yet, but if they pursue it, they may be able to. That's what I've got for you. What's the real answer? You know, universal health care, where we get to negotiate all the drug prices for all 330 million of us. Okay, that's what I've got for you. Down below, you can like, share, and subscribe. You can send me comments through YouTube or at healthcareadvocacy1@gmail.com. And you know what? My wife reminds me to tell you, be healthy because we can ill afford the alternative. Have a good evening.